It would surprise many Australians to learn that more years of productive life are lost every year due to suicide than any other cause. Over 115,000 productive years of life lost. Very sadly and increasingly, that loss is in younger people. Not only the human tragedy, but the social and economic cost. Our approaches need to be 21st century, transformative, place-based, inclusive, working with communities where they are so that we ensure young people get the right care first time where they live. This particular project, supported by the BHP Foundation, has the capacity to be transformative in Australia and internationally.
Systems modelling and simulation gives us advanced capability to test alternative strategies and forecast the impact they're likely to deliver before investing significant time and resources. It helps better understand the combination, the scale and timing of investments and actions needed to deliver real and lasting change. We are committed to an approach that brings systems modelling and simulation out from behind closed doors, making model development transparent and accessible to communities, harnessing their knowledge to make models more robust and grounded in the local context. But most importantly, our program is putting these advanced decision support tools in the hands of national and regional decision makers.
Over the last 12 months, we've been working with the Brain and Mind Centre to design a project which can empower local communities to achieve better mental health outcomes for their young people across Australia. This project uses the power of systems modelling, a power that's been used by business and industry for the last decade or more to deliver transformative outcomes. Through this project, we're going to apply the power of that systems modelling for the benefit of the mental health of young people across Australia.
The great thing about the project is it brings multidisciplinary parties together in partnership, like researchers, people of lived experience, organisations with invested interest, local governments, decision makers and service providers. Through this type of co-design, we are truly able to embed the real lived experience stories like my own into the reform of regional and national mental health care for young people.
I'm looking forward very much to working with the University of Sydney and with a number of Aboriginal communities. We're talking to different communities right now, but we think that we will bring our shared resources together and develop relationships with communities so we can talk about what's needed in terms of data and system change, so we can empower them to better address suicide prevention. What is really outstanding about this project is that we'll have time to develop relationships between ourselves, but also with Indigenous communities across the country to look at how we can work together, spending the time to do good co-design, genuine partnerships to support Aboriginal communities to grapple with the very complex issues that they need to deal with.
The circumstances and issues faced by young people, community members and indeed service providers in rural and remote locations can be very different to those found in urban areas. And importantly, the University of Sydney project will provide an opportunity for local people and the service providers and other stakeholders to explain the way things work across our communities. This information combined with other research data and evidence will create a really powerful tool, and one that should be able to provide us with some very good signposts for the way services could be developed into the future in the most effective and efficient way.
We have kids in our communities that are so strong and so proud of who they are, and we want to encourage that. We want to support what they need and what their communities need. We have a vast range of Aboriginal communities across our region, and from one side of one town to the other, they're all different. So what we need to do and what we're going to do is support these. It's such a great project through the University of Sydney and the other communities and committees that have joined us. We can't wait to see how this is going to strengthen our families, our communities and our people.
I just wanted to say congratulations to the Brain and Mind Centre and to the BHP Foundation for this amazing new program, Right Care First Time, where you live. There's nothing more important than the mental health of our young people. And what we're trying to do here at Sydney is harness the extraordinary research from across all of our faculties to address some of the most important challenges and questions of our time, and this is certainly one of those. We're also looking to work with extraordinary partners. I think we found that in the BHP Foundation.